I think that more than anything, what I've picked up already from the atmosphere in the room, it's lovely to be amongst people from different backgrounds, as I've gathered, who really seems to all be passionate about changing the area and making a difference. And that is really the same kind of philosophy that we have at the Bertha Centre, the Bertha Centre for Social Innovations at the UCT Graduate School of Business. And the centre was started by a South African family foundation, actually an entrepreneur in generic pharmaceuticals, who was passionate about shifting the thinking at a business school. So how do we use business for good, and not just about the financial impact, but also about social impact. So they've really put us in there to be a bit of a kind of a Trojan horse and an activist at the school. And we love our job in that. So Bertha is actually the name of the granny, an old Jewish granny in Joburg. But since then, we've been going for about 3.5 years. The work really stretches from teaching at the school, doing some research work, as well as hands-on implementation projects. And for us, that's really important because we can't be talking and not doing. And the doing fuels as much of the learning. And at the moment, we're stretching across different areas that we work. So I work in healthcare and lead our health team. We've got a team on education, another big social area in our country needing innovative thinking. We work with innovative financial instruments. How do we use private sector capital to fund social impact, as well as starting to investigate what are the routes to scaling some of these innovations and getting them into policy. And as Chris said, my claim to fame is either that I've become, I think, a completely confused doctor somewhere along the way, and ended up at a business school and not a hospital, even though I've got no MBA and no business background, but I've got a background in public health. And it was really my own experiences that has led me here as a junior doctor who saw a real need in our patients not getting the services they need, and having an idea and being told, no, my dear, you're crazy. This is government, we don't change anything, we don't have money, you can't do this. And maybe with just like being relentless, they finally gave in. And we started an end-of-life care service at Victoria Hospital. That was in 2009. The service is still running. It's been scaled up at Curtis Hospital. And it's really been taken serious by the Western Cape Department of Health about how do we, if we can't cure our patients, how do we care for them? And that was really nothing else than just reshuffling our resources that we had and trying to provide care in a different way. So maybe as a start, when we say health innovation, I think this is the first thing that comes to everyone's mind. It's some fancy cardiac innovation. Since 1816, people have been innovating in healthcare, and the kind of long list of accomplishments is there. The one that's actually stuck at the bottom is even in South Africa in 1967, we've done the first heart transplant. So I think often we speak to people about innovation, they go, I don't think this is for me, I'm not Chris Barnard, I can't do cardiac surgery. But I think the striking thing is that despite all this amount of innovation, we really are still sitting with a situation like this in the world where over 30% of deaths are actually preventable. It's simple conditions, infections for which we do have vaccines and treatments, respiratory conditions, maternal health, pregnancy is still one of the biggest risks to a woman's life in most parts of the world. Babies who, again, at the first few days of life is crucial for them, and a lot of them die in that period. Nutritional deficiencies and injuries, and often all these deaths can be prevented. And I guess the question is, why are we standing in 2015 and this is still very much the scenario? One way to start thinking around what is the possible reason for this is that the quality of health services don't quite match the burden that we're facing. And so it's almost the inverse, I think, from where we see that the lowest quality of services is really sitting in sub-Saharan Africa. Some explanation for that could be that we don't have enough health workers. I think anyone working in health services, that is the daily kind of issue that gets raised. If only we had more health workers. Or the other kind of thing is if we only had more money. So yes, there is a shortfall of about 4.3 million health workers in the world. The other problem is distribution. Like if we take half the doctors from America, just put them in the rest of the world, we will be in a much better state. When it comes to public healthcare spending, I mean, the opportunity is huge. The healthcare is a $6.4 trillion market. And even though it's so significant, and if we would divide that by the population of the world, there would be about $950 for every person. This is not the case. So most countries don't even have the minimum $44 to spend on a person's healthcare. And I think South Africa is the same. South Africa has got a $33 billion market. So for anyone who's in business, there's a lot of opportunity. But our big problem here is just the inequity, that we know that often most of the expenditure is sitting within the private sector, and we're not serving as equitable the vast majority of people in South Africa. So this is really, I think, the challenge that we're facing. We do have amazing therapies, amazing medical innovations sitting there. There's been a vast amount of funding from the global community that's been invested in all these things. But somehow, if we look at the health outcomes, there's this big gap. And I think our challenge is really how do we make use of it, and where is the question or the answers we haven't found yet in getting these treatments to people who really need them. I'd like to show you a little clip of the Minister of Health, because I think he really explains it much better than what I can. He was at a summit that we held at the beginning of last year, and similar to the Greater Tygerberg Partnership, a big role that we're trying to play at the Birthday Centre is bringing people from different sectors together, because we truly believe everyone has a role to play in healthcare, and we've all experienced it. So in some way, we do all have expertise to make a change.
In your view, what are the three main areas of innovation that healthcare needs that we still could do?
Well, I was saying throughout history, if you look at the 6 building blocks of a healthcare system,
yes.
There are 2 which innovation has not been very good or has not been followed.
Yes.
It is the issue of the financing of healthcare throughout the whole world, not only in one country. But more importantly, healthcare delivery systems.
Yes.
We've been innovating drugs,
Yes.
we've been innovating diagnostic, we've been innovating therapeutics and machines and all that. But when it comes to delivery systems,
Yes.
we've been lagging behind. And I'm saying that needs to be done. And I gave a simple reason that, for instance, patient waiting times is suddenly something that nobody ever thought it would be a big problem. But it is, because of the burden of disease is growing on the African continent. In South Africa in 2009, we were having 923,000 people on ARVs. We suddenly have 2.4 million. They go to the same number of clinics, same stuff, yes. Now in 2016, we'll be having 4.6 million people. The clinics are unlikely to double. It's not possible.
Yes.
And the number of staff is unlikely to double. It's not possible. So what do? You need some new innovation, because those patients are going to find life unbearable. Yes, because they will have increased fourfold actually. Now it's twofold. It will have been fourfold. And what do you do with that? You need some form of innovations to solve that. That's where innovations of healthcare delivery systems come in.
So I think he says it really well. And South Africa is a real success example of being able to provide antiretrovirals to people, and yet there's no way we're going to meet the demand. And I think getting stuck with the same old, we don't have enough workers, we don't have enough money, is not going to get us to the reality we want to see. So how do we really start, I think, reimagining what could be, and taking the resources that we do have, which is so rich in this country, and thinking differently about how we could be using them and who could be contributing to that. So there's a real opportunity to innovate within healthcare delivery, and that really just tries to get to how to provide integrated and effective services to people who really need it, with all the treatments that we exist and that we know that work. A notion that's coming up is saying it's not just about providing care and that's the end of the game, but providing care that really improves outcomes and achieves value. And I think value is a new notion that we've seen coming out of the States quite a lot, of saying what is the outcomes that matter to a patient. So how do we deliver our healthcare services so that people either survive, that they can get back to their daily lives sooner, that they don't have disabilities after a health incident, and really at a cost that is affordable. So at the Bertha Centre, we think that the social innovation has a role to play in addressing this big challenge. We don't see it as the golden bullet, but really as a new lens that we can apply to our current state. And it really is a type of innovation around creating more effective and efficient and sustainable solutions which have a broader value. So more than just financial impact, but really social impact to society as a whole. And second definition, which we really find even pushes the boundary of just developing these new solutions that can achieve that, is saying a real social innovation goes beyond just the immediate outcomes, but really affects the whole system. And I think in South Africa, we're often facing a lot of systemic challenges. So it needs to affect and change even the routines, the resource flows, the beliefs of the social system. So it has as much to do with people as it is about the solutions. And this is really just trying to get to a bit of an explanation on what is the different paradigms that kind of we can look at. And social innovation really just brings a transformative lens to, instead of looking at problems, trying to focus on possibilities. And I see that's kind of almost the slogan of the Greater Tygerberg Partnership, looking for strengths, focusing on co-creation, which means involving our communities as we're trying to design new solutions. Moving away from just developing people, but really allowing evolution to happen, and that it really is a continuum. It's not a magic solution and doesn't fix everything, but it's an ongoing process. Within the health space, we've been trying to frame a bit of an approach and some principles which we found has been really important as we started engaging more in public services here locally. That the best innovations are really ones that's based on a real health need. Often we read academic literature and can state the amount of the disease burden, but really what is the need as experienced by that person living with a disease. And that takes quite a lot of work to understand that, and spending time with that community, or even with that health worker, understanding from their perspective what are the real problems. We often have great ideas, but we're applying our ideas to the wrong challenge. So how do we design and develop solutions that really meet the needs for the people and do it in a way where we're inclusively co-creating it? So any complex systemic challenge needs more than one perspective, which means it's definitely not the doctor, and I guess that's where I realize my prescription falls short, that it is the business expertise, the kind of design, the innovation, the broader expertise that will allow us to develop solutions together. And as a way to do it, that we're doing it for people, with people, and actually one of the most important changes that needs to happen are sometimes just mindsets. Using the same resources but changing and challenging mindsets to allow us to get to not just correction or improvement, but actually transformation. So some of our work has been, as Chris mentioned, really at HEURISTIC Hospital, and so we've tried to apply some of this learning and seeing what happens if we get our hands dirty. And again, understanding what are the challenges from people working daily at the front lines delivering healthcare. And as you will see, very little of those have got to do with specific diseases per se, but really around how do we change our perceptions around waiting times, how to improve care and dignity to patients, aspects around tracking and communicating, which opens up a whole sphere for any technology innovation that could address issues around that. Note keeping, everything is on paper, what could we be doing to make it more efficient? And a lot of our challenges are really between the interface between what happens within a hospital and the links between the community. And I think that's a huge area where it's not the sexy area for innovation, but how do we create solutions that really build the bridges and create the links between the health services and the community. So to think through what are the possible social innovations could be, it could be anything, and I'll start at the bottom, from a process or a service, it could be a product, it could be a role or behavior. Task shifting has been a concept which has become quite well renowned, shifting the roles from one healthcare provider to someone else who could fulfill that. It could be a novel market mechanism or a business model. about providing care in a more cost-efficient way, or it could just be a change in a paradigm or a policy that allows us to achieve change. And really, all actors need to be involved in coming up with innovation. And I think this room really represents all the various sectors that is involved. The notion that we've been trying to work on is saying that we're not going to focus on a specific type of innovation within the Bertha Centre, but really that we're looking for solutions with specific qualities. And the qualities of an innovation should be inclusive, improve the equity and access to people. I think the days are gone where we can be developing solutions that only addresses the needs of a few people, especially in South Africa. Doing innovations in a way that we actually measure the impact. There's a ton of apps out there these days, but often we don't know if they really are making a difference. And then doing it in an affordable way, such that allows it to be scaled up and implemented more broadly. We've been really fortunate to work with various people. So I think the notion that there's not enough innovation is actually wrong. There's plenty of innovation happening from within our healthcare services, and it's been really exciting to get to know these people, study their work, understand how they've done it. The bottom example is Gula Mobile. It's actually a doctor working within the Tygerberg Hospital who's successfully developed an application for improving eye care. The real need that this application is addressing is around the referral process. So using mobile phones for patients to be referred from one provider to the other, bypassing the old-fashioned let's fax a letter to the hospital so that an appointment can be posted to a patient. Solving a real challenge. They've won the SAB Innovations Award. They also got 1.1 million rand worth of private sector investment on Tuesday evening through the Spark Up competition that was happening in Cape Town. So investors are spiking up and saying there's a potential for profit and revenue here while having a social impact. One of the applications at the top is an electronic discharge summary developed by a clinician in HEURISTIC hospital that has also been successfully scaled up. Government is taking it on and it's been rolled out at Tygerberg. Our nurses within Red Cross Hospital have been running an amazing program to try and provide better care for patients with tracheostomy. So often these kids would have had to be in hospital for many, many weeks. This nurse is teaching their parents to take care of them at home, a very specialized task that now a mother is performing. And the last example is also of a young doctor in training, a surgeon, who just got frustrated by breast cancer patients having to wait over 3 months to get in surgery after being diagnosed. And she's raised some money to use the time when theatres are standing empty to go in with her and her colleagues and do a whole catch-up list of surgery for patients, and also provide them with that care in a holistic way, knowing that it's more than the medical treatment that makes a difference to a patient, but often the supportive care they get at a time, which may be quite stressful to them. And then there's just a variety of amazing people in the greater Cape Town area doing transformative work in their local community. We spent time studying these models, and when we sent out a call to find out what people were doing, we were overwhelmed and received about 100 applications from across the country that we then synthesized into a bit of a publication. And these are some of the examples. Sizwe Nzima, many of you might have heard of him. He's a young graduate from the business school, actually. He did an entrepreneurship diploma with us, and when they told him to go solve a problem, he tried to solve his own problem. He had to go to the clinics, wait hours to get his grandparents' medication, and thought, why not start a delivery service? And him and about 5 of his young colleagues from Khayelitsha is on their bicycles every day, picking up medication from the clinic, dropping it off at a small charge to the patient. Some other entrepreneurs in Cape Town, the Hello Doctor crowd, who've really been successful at improving health education to patients through a mobile platform. Shona McDonald, who's developed wheelchair devices at a very low cost for children with disabilities. Again, addressing a need she's had to overcome with her own daughter suffering from disabilities. But more than just the specific solutions, I think a real role that the private sector and academics and government can play is developing the capacity for innovation. So if this is an untapped opportunity for us, how do we support more of this happening? If we stop waiting for government to give more funding or for more health workers to be trained, what could we be doing to just unlock the potential that's sitting within our healthcare system and often within our health workers? They've been testing a program at Groote Hospital. An innovation fund was developed, which was the hospital charity board providing 2 million rand to support frontline workers coming up with ideas to the problems that they've identified. It's been really successful and an amazing journey to have watched workers come and tell us, I'm just the guy from switchboard, I'm just the pharmacist, I'm not sure I've got an idea. To see with a bit of encouragement, support, skills and knowledge, how they've flourished and taken something that was an idea, refined it, developed it. We've funded 8 of these ideas, almost to the value of R1 million so far, and these staff members are implementing their ideas. I think important to notice that they're doing it over and above their daily work. None of these people have been given time off work, none of them have been given special circumstances. They're passionate about trying to improve the care for their patients, and these projects are being implemented as we speak. Again, a huge opportunity for people from the private sector to collaborate with frontline providers and saying, here's some skills that we've learned, here's some resources that we can share with you, and work together on a project to really reshape the healthcare services. Along with developing capacity and knowledge and skills for frontline workers, another concept that we've been testing is how do we create almost a home away from the mental iron cage. Often the biggest challenge that we have is our thinking that we can't create new solutions, we can't do healthcare differently. And creating a space and an environment where people can come in to do that has been really beneficial. In February we launched the Innovation Hub at Groote Hospital. The hub has been donated to the province as a much broader initiative to really be a space for all people throughout the province to go to utilize the facilities. We've invested in trying to create a different environment that allows creative thinking, new ideas to emerge, be a neutral space, and also a space where some in-depth understanding can happen about problems where people from the outside of the healthcare system can come in and engage with health workers, understand what the real needs are, and then come back and as well test their solutions in a real living environment. And it's been exciting to see how this has been taken up across the hospital from different departments, different kind of cadres of workers, having people visited from across Cape Town. And lastly, as I mentioned I think before, saying innovation does carry a risk. Innovation does fail, and we do need to know if innovation is actually being effective. We can develop a lot of things, but without some rigorous evaluation, knowing if this is really making a difference, it is very hard to build a case for saying let's take this from one hospital and scale it up and share that idea across the board. One of the projects that we're doing, which is really around trying to understand what has worked, what hasn't worked, and why has it worked, is in partnership with the World Health Organization. It's been interesting to see how them, as a large multinational agency, has realized that there is this gap between all the scientific development that's been and still the lack of providing adequate care. So they've taken social innovation really seriously and given us the opportunity to study some models across the global south. So we went out again searching to see if there's anyone that's done anything to improve specifically infectious diseases of poverty. And we found about 180 different solutions across Africa, the vast majority actually sitting in Africa, especially East Africa. There's a real creative buzz happening in the East African environment, as well as in Asia. And currently we'll be studying 25 of these models. So we're very fortunate to be doing site visits to each of these places, learning from what they're doing, really with the aim of saying how do we take these best practice lessons and share it broadly and also translate it to what could be useful in South Africa. I think that's really just a bit of a quick overview of some of the work we're doing and our thinking around innovation. Can't see my bottom. It says it's always sit say heal, never innovate, think, be yourself. And that's really what we want to encourage you. I think everyone in this room has had an experience with healthcare, has got a possible solution, a skill that they can contribute, or some resources. And I think in the spirit of the Greater Tygerberg Partnership, it's an opportunity to really reshape healthcare within this area by pooling all the talent and knowledge in this room. Thank you.
Lindi, thank you for a really fascinating and comprehensive talk. Thank you.